And let's go with the agenda. Let's do roll call. Susan.
Present.
Kim.
Present.
Me, yes. Zach.
Zach, present.
And then once again, Dr. Chaffee is on his way. Okay, let's do the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All righty then. So, has everybody had a chance to look at the minutes? Any questions, concerns?
Can we do yes real quick?
Oh,
We don't.
well, it's not on my, if it's not on the agenda, we can't do it. Sorry.
It's
It
right.
is on the agenda.
Okay, let's do guess. Who's our guest?
Oh, hi, I'm Cheyenne. I'm currently a health educator here, but I will be transitioning into Rebecca's role on Tuesday.
Welcome aboard.
Welcome.
Good luck.
And normally the manager or supervisor would introduce, but apparently Taylor's not doing that. So,
This is Cheyenne from Gosh Internal Quality
Very
Accreditation
cool.
Quality
I think I've heard
Improvement. She's so far away, I can't even see her.
Okay, well, welcome. So, all right, now can we do the board meeting minutes stuff? Anybody? Concerns, questions? Addendums?
I
Do we have a
move
motion?
that we accept the minutes
Wait a
from the
second.
April 16th board meeting.
Yeah, second.
Second, any further discussion? Susan?
Yes.
Kim?
Yes.
Me, yes. Zach?
Yes.
Okay, do we have old business here? So what do you want to do? Just go straight to reports?
Yep.
Okay. Director, you're up.
so, another decent month on bottle records and moving the card, scroll down so I can see the 5-year history. There was actually 1 year where we had, more in 2023, we had more applicants for vital records. So that was actually the first year that we were here. So that was interesting. Go ahead and scroll.
So you're saying basically we've already surpassed that essentially, what you're saying.
It is,
essentially.
but right.
That's good.
You can go ahead and go down. So, we've had, this is officially so we moved in 23. So this is our 3rd year now that we've been here. We've had some HVAC system problems off and on. And it is just now getting, so we got our heat issues fixed. So that was good. We quit being cold over the winter, got that figured out. Last week, it actually started getting hot and humid. Just about the time we were starting to troubleshoot that, Monday or Tuesday, we're like, okay, now we can start kind of troubleshooting this. Then it went to like 60 degrees. So we couldn't, we were about to call the heating and cooling guy back out so he could start doing some stuff again. Well, he can't because it went to 60 degrees.
How humid was it?
It wasn't so much humid. It was, it was in the close to 60%, but the dehumidification, at least in this room, did not seem to be coming on, and the temperature was not cooling to what the set point was. It was off a couple of degrees. Like throughout the rest of the building, you set it to 74, it cools to 74. And here you set it to 74, and it would go like to 72. Well, in my mind, set it to 74, it should cool to 74. So we have some troubleshooting actually in this room or in this RTU2 and RTU1, which is the admin wing. The rest of the building pretty much does what it's supposed to do.
Oh, that's positive.
It's good. Yeah, better than all bad news.
Which is good, but we need it to get hot so we can figure out what's going on.
Right.
Dustin had some staff that were pretty warm the other day. And it was one of the transition days where it was 62 degrees and they're like, it's so humid. Well, that was a relatively easy fix. The fans had not been switched back to where they ran all the time while it's occupied. So the temperature was actually fine. It was 71 degrees, but there was no air movement. So it was just that kind of stale air so some of the stuff we're just needing to get back to where they had done a lot of troubleshooting with the heat, that we need to get the stuff set back. And I think once I set it back, they were fine.
Yeah,
Right.
picked it really quickly, so it wasn't much of an issue after that.
But anyway, we're still playing with the HVAC stuff. The state of Missouri put together a group of 11 health directors. They actually had an application process, and I was one of the 11 that got through the application process and was selected. Originally, it was 12 that they were looking for. Sounds like that was a highly selected process that I got elected for. Well, there was only 11 that applied, so it wasn't that big of a deal.
But you were one of 11.
Yeah. So it sounds a lot better when I say like I was selected as one of 11 out of 115.
Sounds good.
But went to 3 in-person meetings, and really what the meetings were about, and you're going to hear more about it probably from either Taylor or Cheyenne in the future, but it's about resource sharing amongst health departments. So as you all know, we do a lot of resource sharing when it comes to the community health improvement plan and the community health assessment with Clay County. But we have done that for years. And you have heard me at least say, oh, that saves us so much money and resources, and we do that collaboratively instead of doing that all on our own. But there's other ways that and there will be contract or grant money available for us to look at other ways to share resources. But it's just something that the state is pushing incentive money towards. Taylor later in the presentations today will be talking about how this year's incentive money were awarded and how we got that. But for 2026/27, the incentive money will be geared towards resource sharing. So it'll be kind of neat that we'll have people, me, kind of steering how that money will be available. And the first 3 meetings, we actually paid for me to go out of our pocket. And one of the things I said to Patrick, who is spearheading this for DHSS, I'm like, yeah, you need to put some money aside for the people that are coming to support this to pay for that out of those funds instead of each of the health departments. And so they're taking care of that in the future. The next thing is they have a spring and fall regional meeting for all the regions that DHSS hosts. This is the second time in the past year, I think, that we've hosted one of the meetings. I think we hosted last spring, right?
Yeah, or maybe it was 2 years ago,
Okay,
something.
within the last 18 months, anyway. But
So are they choosing to come here, or are you inviting them, or how does this work?
they love having the meetings here.
Oh,
It's a
Okay.
great location.
is it
I
close to the
reached out
airport?
to them and asked them if they wanted us to host
She
it.
likes, well, like the other places are not very good facilities
Right.
typically. This is a great facility. Plus, we don't have very far to
I
drive.
was gonna say,
when
that's a
it's-
bonus.
Yeah.
We have to go all the way from that side of the hall to this side of the hall.
Yeah.
And Cindy Kogan always does a nice job when she's here, this job, this time she kind of let us down. She wasn't here,
Hmm.
but
Who,
so
me?
Cindy Kogan. So I had to empty the trash and I had to work. So I did not like Cindy being gone. But
Mhm.
it is always nice to have the meetings here.
Mm-hmm.
They always appreciate the big room and
It's a
the
nice
nice
Yeah.
facility and good parking.
Mhm.
So what was the takeaway from the meeting?
You know, they talked about the resource sharing. They talked about the lead program. What else did they talk about? I mean, it's
We
just
talked about the
random.
maternal child health grant and some things that are coming up with that. Just emerging health concerns, some of the funding opportunities. And
So it wasn't anything in particular. It's the DHSS updates. It's part of how they reach out to us to keep us engaged. So I don't know that there was anything specific. One of the things they did talk about was the board of local boards of health stuff. So they did mention that.
Mhm.
So legislative updates, stuff like that. So,
Okay.
budget overview. At the end of April, we were 1/3 of through the year. So it's every time we talk about this, it always amazes me how fast the years we fly through the year. But we were a third of the way through way through 2026 at the end of April. We had collected $2,910,423, or 69.6% of the revenue for 26. Our expenditures, we had spent $1,234,016, or 29.5% of the expenditure budget. So pretty much right in line with where we should be. Our money market account, we were at $2,045,737. That is about $571,144 less than last year. Just to remind everybody, we did take $250,000 out, put that into a CD, and then we're also putting money into our reserve accounts.
So the CD matures, you said August 23rd. They've already contacted us to start working on renewing it at that point, or what's the plan?
We
when that
won't
happens?
renew, we'll need it for operating funds.
Okay.
We just have it there so we make a little bit more
I get it.
money instead of it just. I mean,
All the money will be used up, essentially is what you're saying, yeah. Mhm.
it may not all be used up, but we don't want to cut ourselves short.
Right, I get it.
Our lease purchase debt obligation, and as I mentioned earlier, we just hit 3 years in the building. So we are at, and we took our first disbursement in 2022. So the loan is essentially 4 years old, roughly, and the original amount was $5 million. So as of April of 26, we are just a little bit over 2 million. So we, one way or another, we've sold buildings. We've stopped short of robbing banks and stuff because Taylor says I can't do that.
Donated
Dr.
plasma.
Chape says that's okay if you don't get caught, but we don't do that.
Right.
No.
I've done the plasma thing. You get it like $8. It helps.
So, Plasma Tuesday. Cheyenne would love Plasma Tuesday.
Yeah.
But I did want to point out, and it just was something that struck me, we are doing it is pretty neat to see that we are, getting close to that 2 million mark. And, we'll be real close to that by the end of the year. If not there, we should be probably there, I would think. But we are getting that whittled down. Another good piece of news, the customer service survey for April, we had 22 Survey submitted, scroll down. I'm glad I was right. It'd be embarrassing if I was wrong. But we had 3 people that rated us 4 stars for our service. 1 person rated, and then the rest 5 stars. 1 person rated us for 4 stars for how easy it was to use our services. 21 5-star, and then the same for how friendly and helpful our staff was. What did you like about our visit? Again, you can just see this, and it was in your packet, so I'm sure at least Dr. Kingsley went straight to that.
I went to the one where the guy wrote a dissertation. That was
Yeah,
really
no
cool.
kidding.
Now, who's our staff member that is Kim?
I have no idea who that's referring to.
The only Kim I know is this Kim.
So you were there
So
that
did
day?
you sneak in? Did you sneak in and just give someone
Shook
wonderful-
somebody's hand and gave him a cup of
Welcome,
water.
welcome.
So,
That's fun.
or did someone?
I'm
Right.
wondering if either A, maybe a swope employee, 'cause I think someone
Oh, okay.
checked if they had swope.
Okay, all right.
That's my guess.
But this was pretty wonderful. So from the first phone call until I walked in your office, all of your staff has been absolutely amazing. Your nurses walked me through everything. Jackie helping me to find records because I'll be 50 this year and I was born in the 1900s. We're not cool enough to have records verified for everything for the other country we are visiting of what I need and what I didn't need, and made everything so easy. Even with her being off today, the day that I visited from the previous day and speaking with her, she had all the notes ready to go, and I was able to find my old shot record to have it loaded in the system. I think I remembered all the names: Jackie, Carla, Kirsten, and Juanita. I think there was 2 more, but everybody hands down has been absolutely amazing. 100%, 1 million job. Keep it up. That's exactly how staff teams, everybody should work as
As
a small business owner myself. The process was so smooth. So
Very nice.
Yes, that's very cool.
pretty awesome and pretty fantastic. She took the time, or he,
Yes.
I think it was a she,
Took the time to do that.
took the time to remember everyone's name. So I won't be at the staff meeting, but make sure you give kudos to all the staff by name. And I believe that's my report.
Okay, so we've been working on CPR training, making sure all of our staff is up to date on CPR training, before the World Cup comes up. So I think a lot of us have done our CPR trainings in the last month or 2, if we hadn't done it already. We also turned in the Mo gap analysis in April, so I don't know if you all remember, but that was something we've done the last few years. The state of Missouri, along with MU, is collecting data about all of the health departments in the state of Missouri to determine how many hours and how much time is being spent on different things, essentially so that they can decide how to allocate funds going forward and potentially showing opportunities where they might be able to give us more funding, hopefully. Yes.
Do we have access to their data?
They usually present it each year at some of the conferences, but I don't think we have this year's data yet.
The only reason I'm saying that is it might be interesting to see what they're valuing as fundable, to make sure we're on track with our goals being fundable, and
Sure.
if they have funds available and their goals align with ours, it's best to find the way they'd like it communicated.
Right. So I think right now I want to say it's a 5-year study, and I think we're on year 3 of it.
Okay.
So they've been doing it for over a few different years. I don't think a ton has changed over the few years, at least from our perspective. But
So it's all tied back into the foundational public health services model. or the 10 essential public health services.
Right.
So it's all, everything that we are doing as far as accreditation. So it all goes,
Okay.
it's all the same stuff. So everything that we are doing ties right back into it. So
Thank you.
it's nothing different.
You answered the question I was looking to make sure we're gonna be paying attention to.
Yes.
I didn't realize that. I appreciate you
Yeah,
having
it's-
that insight.
Yeah, it's all.
Susan and I, when we went to the state meeting, we saw firsthand, not every county's the same, that's for sure. There's a lot of gaps out there.
Yes. And so whenever we are discussing the gap analysis, we're not the best, but we are we're in the top, certainly in the top 10%.
Not even
Sure.
1%? Come on.
We have, one of the
Funding,
reasons
I
we're
think.
doing it, one of the reasons we have all the quality improvement stuff we're working on is we're continually striving to get better.
When we were talking about how great this place is, we actually made the other county start crying, and that's no lie. We actually had to go talk to the lady and apologize or something.
Yeah.
She started crying. So whatever we're doing pretty awesome. I'm not here to toot my own horn, but
Making people cry.
making people cry. That's how bad it is in some of the counties. It's that
I
bad.
think she was just overwhelmed on how many things there were to do, and
Yeah.
she was one person.
Oh, but-
Yeah. And
We have opportunities that that place obviously didn't have.
And that is true. And we have resources that they don't have. And,
Right.
no,
you know,
it was down south.
she will tell me later that, how much I suck up, but we have a very supportive board that is helping us meet those goals. When she wasn't here and we were talking about moving towards accreditation, and I asked for the funding to create this position or not her, but it was her position at the time, but to help us do quality improvement and accreditation. I don't know if you all remember, it was not an easy sell at first. We actually had multiple conversations about it. And what was the value of that? What is that going to get us? And why, Andrew, is this dumb idea actually something we want to do? How is that going to make us better? And we talked about it, and Tiffany from the state came, and she actually helped me be a little more she helped me be a little more eloquent about why it was a great idea. And it was some about that gap analysis and how we were being measured compared to our peers across the state, and providing those essential public health functions and how that was being measured uniformly and providing those services. So sorry, but it does make us a better health department. And I think Cheyenne is starting to, Rebecca's trying to give her a fire hose while she is walking out the door, but just all the different things that we are trying to do all at once to make us better.
All right, so one other thing that I've been working on a lot last month or two, I think at our last board meeting, I said when we spoke with Tech Electronics, we had everything was great with our fire inspection because that was what we were told. Then the fire marshal came in as I was heading out to the St. Luke's Community Leader Conversation, which is part of their community health needs assessment process. And the fire marshal came in to do his inspection, and he said, "You have several deficiencies," which we were kind of shocked about. It turns out Tech Electronics had hired new people, and they hadn't told us that from 2024 we had a few things that were deficient. Now, I don't want that to scare you too much. I talked with the fire marshal today, and he said, "You guys are not someone that we were concerned with. There's a few things that we're working on. Some of it was just people didn't turn in their paperwork who had done some of the work for us, and they needed to put it into the system. And some of it was the fire, the fire alarms, a couple more of them were missed and they need to be dropped from the drop ceiling. We have Alpha Electric coming out next week to finish that job. They apparently missed 8 of them when they came out to do it originally. And then we also have one horn strobe that it's one of those things that needs to be replaced in the far east hallway. But we were getting there, and the fire marshal is very, very willing to help and work with us, and he understands that it was not our fault and we were unaware of this, so you know, it's
Mr.
been a
Doug,
big learning process,
it
but
will be a pleasure to razz Mr. Doug Jones, who's the gentleman is signed to this area. How did they miss this the last 2 years? Gee, we were at risk.
yeah.
Shoot, I'm
yeah.
glad they got us in compliance. We
I-
didn't know.
I don't know
I'm gonna have so much fun
what
with him.
happened.
And
Okay.
we do got a new
He's
fire
been
hydrant.
he's been
He's a
really,
great guy.
really great and
Absolutely.
really willing to work with us. He's answered my calls and talked with me.
We're live streamed and recorded. I'm speaking highly of
Yeah,
him.
yeah.
I mean it from tongue in cheek. He's a great,
Yeah.
great fella.
Did you tell me about new fire hydrant?
Yes, so that was one of the things. So Jayhawk hadn't uploaded that we had the new fire hydrant, so we failed on that too. But now Jayhawk has uploaded that into their system, so he said that one we're no longer deficient in. We're working on it. We're almost there, and it will be taken care of. And he was like, "You guys are great. Don't worry about it." Like, so that will get done.
So the thing Taylor's talking about, dropping things out below the ceiling, that's actually from the remodel, from the time that we moved into the building, and it's stuff that originally they were supposed to disconnect from the system. They didn't disconnect it. It's from the original building, and they were supposed to disconnect it when we got our new panel, but they just tucked it up in the ceiling.
So it's
And
these
so-
guys, those fire alarms there, they're
Oh
just
my,
hanging out in the ceiling rather than
And
being.
so we would get,
wow.
because dust and stuff will make these go off, we would get some alarms, and we found out, and I'm like, you need to either drop them or you need to remove them. And so we did eventually get them at the end of last year to come out and drop them. Yeah, we got them all taken care of. Well, we found out 2 weeks ago, 3 weeks ago, they missed 8 of them.
Yeah.
So Taylor's getting them, and they're coming back out, they're taking care of it, but
So how did they find them?
That's what I wanna know. They
What?
must have some system where they can tell that 8 are not.
they're still programmed in the system.
No, if I may, I have dealt with this quite extensively. This is how I know very well Mr. Doug Jones. You just have to meet code. And the code, for public buildings is set. You don't have to have an extinguisher in every room. You have to have them accessible near the room, for example. Additionally, if you have an extinguisher there, it better be kept up to inspection. Finally, you can run around and put as many fire alarms as you want up. Bottom line is, how many do you need? Most people don't know the code. So that's where they come into play. Well, we've got a service company that's making sure our extinguishers are working fine, our fire suppression is tested, and our fire alarm system is active and functioning right. That's a premium price, but it's public safety and it's important. So keep in mind there's the code, and then there's what everybody's going to say, hey, what you should have. Many of those fire alarms we don't need, but if they're in place and it's inexpensive to move them, I'm in support of it. But I want to give some scope to the nature of this, that it's not this city coming down on us and being very heavy-handed. No, they're just saying, hey, if you got this, you pull it or put it in properly.
So, and that's exactly right. We don't actually need them, but they are hooked up to the panel.
Yep.
And they were up in the ceiling. I actually asked for them to be removed, was what I had wanted, and they did not disconnect them.
Mm.
So when they installed the new panel, they just hooked them all back up, and they can't just be up in the ceiling. So it would actually cost them more to disconnect them all. So they are just dropping them. And so we have kind of an overprotected building. I don't really care.
Put notes in your journal for your successors down the road that as they begin to fail, you might mark which ones are at a minimum to meet code, and then as they fail, you can weigh the benefits of replacing them.
Yeah, they're pretty common. They're fairly easy to work on as long as we can get to them.
Mm-hmm.
we actually know how to repair them, so anyway. But finding them and,
I've ran around my building with a ladder many times.
yeah,
So the fire marshal hadn't been here?
they've been here.
He had been here, so I'm not sure. I think what happened was that Tech Electronics hadn't uploaded it, and they use a system called Bracer, and that's where.
So it was mainly a paperwork.
Yeah, and so I think they uploaded something and it said we haven't done it since 2024, but we talked to them and they didn't tell us any of this information. Like when they were here and did the inspection, I asked them like, come talk to me afterwards, let us know if there's any deficiencies, like I'll sign the paperwork. Rather than coming and talking to me, they just drew a line through the signature line and didn't get a signature. And then I followed up through email and I said, hey, could you send us a copy of the reports? And I was like, did we pass or fail? And they're like, we don't really decide if you pass or fail, but you guys are you're in good standing is what they told me. And then later the fire marshal comes and says, oh, you're deficient in this and this and this. And I said, that's weird. So I went back to Tech Electronics and they said, oh, we just found this report and apparently they had uploaded it saying that we were deficient, but they didn't tell us that we were deficient. So I guess they haven't done it for the last 3 years. I don't know.
So
a lot of people dropping the ball.
Is this one of our vendors that we're
and
paying?
we're just trying to
What's that?
fix
Is
it.
Technotron, those one of our vendors that we're paying?
Yeah.
It is.
Oh, I would, yeah,
We're
you need to
gonna
go
look
ballistic.
into some other options
Yes.
in the future, because they also moved from Lenexa to Topeka and they charge a service fee based on distance.
Oh.
So, yes,
So we are
we're
looking for
gonna look at
another
that.
vendor.
Sounds like a good time to do that.
So one thing I will say that you will see from us for something else that's quasi-related to the fire system, we have a check valve for the sprinkler system that's in a pit out in the front yard. And every time we need to have that check valve inspected, we have to manually pump the pit, all the water out of the pit, because the electricity out to that pit is no longer working. At some point, the electricity got cut, whether it was during construction, whether it was before we took over the building. Anyway, we will be getting, and we've been doing various things to get power out there, none of which is a great solution because right at the moment, like that pit's full of water. So we prefer to keep it not full of water. We'll be coming to the board with a proposal of some sort to run electricity out there. Should be probably in the $4,000 to $6,000 range, but we do have to get power from the building to out to the middle, almost to the street out there. I think what they're going to try to do is run it through conduit that is going out to the new lights and then trench from one of the new lights out there. But just wanted to let you know that is an expense that will be coming.
So what does it do? It powers our sprinkler system or something?
Sump pump,
Sump pump.
essentially a sump pump.
Backflow device.
The backflow is in the meter pit.
Mm.
And I was grinning up here year to year because 5 weeks ago, I tweaked my back because I had to climb down a 10-foot ladder into a meter pit that I had to pump out 10,000 gallons of water by myself. And so I'm grinning ear to ear thinking, oh my gosh, you guys are having the same issues I had.
So we could just call you.
Not anymore.
So we don't need any money.
As of my MRI Friday, and I am,
You could probably just pull your truck up and we could just run
There you
the
go.
pump off of it.
Right.
There you go.
So no, but the backflow check valve is installed down in the meter pit, which means groundwater, when it seeps in there, they can't get to it. So they have to keep a sump pump as the water gets up to say 3 inches and the backflow valve's at 9 inches. It's going to evacuate what's in there, but they have to have power to it to run that.
So why would you put a meter there to begin with?
Backflow meter, well, I mean, it was the easiest place. You'd have to ask the people who put it in to begin with.
It just sounds like it's.
Listen, the people who built the building I have put it underneath the women's vanity in the first floor bathroom.
And if it gets too high, does it damage all the electronics? If the water level does?
I mean, it's just,
No, they can't get down to it to read it.
So that's all it is, it's just to read it.
Yeah, you can pump it out each year,
yeah,
but the cost of pumping it out and then getting somebody down there to certify the backflow valve is functional. Then they have to do it. It has to be a person certified to do backflow valve checks. To get down to it, you gotta pump it out. Well, you can go out there and set an appointment every year and get your pump and empty it out and let them calm down, come back up, or maintain it.
yeah, we just can't, they can't have any of the nasty water that's in the sprinkler system going back into the municipal water supply. I mean, that's the whole point of that. So that's what they're checking.
Right.
And
Okay,
we have just been pumping it out,
the beat goes on.
but it should be, yeah, so it's always clear. It would be better for everything that's down there.
Mhm.
So in the future, you'll be bringing us a proposal about
Yes.
this?
She was talking about it, so I felt like
Yeah.
instead of surprising you and saying, you know, why didn't you mention that when she was talking about the 14 other million things, just let you know that that'll become, there's not a huge rush. We've been doing it kind of manually for a couple of years, but
Yeah, I just
Cindy
go out
and
there
I
with the
have
bucket and empty it out.
Cindy and I have been, we've actually just been trying to find a good electrician that had better ideas than $15,000 to $20,000 to just run all, because that's what we've been getting, was no one wanted to do kind of this workaround to get us close.
May I ask if you did inquire from one of our local vendors that I've had good experience with, named Mike Hagan Electric?
Nope, but we will.
And just let them know I suggested you call them. They're very reputable, well-known in the construction industry. I don't have any personal friendship with them, but I throw the name out just from my experience in getting issues like this taken care of in my building.
This is in our arena of just getting 3 bids, so we have 1, so we will get 2 more.
If you want to meet me afterwards, I'll give you the name of their main guy who does the bidding. And he's very seasoned.
Okay, great.
He'll get you fixed up.
And just several committee and board and other community meetings this month. Here's some of our events that we've had. We had the Arrival Live event, our health educators, and lots of fun, exciting things. Here's this month's harvesters numbers. Yeah.
Yesterday, I had parked in the garage to unload some things, and Trisha came to me and said, hey, you might want to move your vehicle. The sheriff's department's going to be here to do a car seat install. And apparently, someone was getting 6 car seats for their family. They had 6 kids, all getting 6 new car seats.
Sounds awful.
It's a big car.
Zach, can you relate?
Yep. I spread them out.
Sorry, Zach, I should have said no.
And she was just kind of laughing. She's like, so you might want to move your car. And she wasn't telling me, like, because it might be kind of crazy in there. It's like, you might not want your car in the garage.
I thought the
But that's what
Geneva
she-
Convention ruled out cruel and unusual
Yes.
punishment.
It is illegal.
That may break some codes.
Oh, my gosh.
Oh, Lord.
But it is,
God bless them.
but
Yeah,
the garage
bless them.
is pretty awesome to be able to do stuff like that. And it wasn't particularly hot or anything yesterday, but to be able to work with our partners and for them to be able to come and do that kind of stuff is fantastic.
Especially when you have weather like we've had for the past month now. You never know when it's gonna rain again.
Right.
So for my board report, nothing super exciting. A lot of things just kind of in the works right now. So we've been talking and looking at expanding some of our services. So I know I've been giving Cindy a huge headache with all that stuff. But we've got some, we're trying out some like monthly visits at the library and just kind of talking about vaccines, have like different topics for each month as well as providing vaccines while we're there. We're looking at expanding into doing some more travel vaccines. We've gotten approval for yellow fever again. We're just waiting for the stamp to be sent to us, and then we'll have access to be able to go through and order that and provide that here. Most of the closest places are like Passport Health, which is very expensive, as well as like in-house pharmacies over on the Kansas side. There's not really a good local place to be able to get a lot of the travel vaccines. So we're trying to, hopefully being this close to the airport and things like that, we might be a fairly decent place to come and get that. Yes.
Have you coordinated or communicated with any of the infectious disease departments as they might want to coordinate what they would deem as ideal access to the community, especially near the airport? There may be some ideas and synergies they could work with you, even holding a travel clinic once every 3 months,
Yeah.
where a lot of the services could be coordinated up here, or however, just a thought.
Yeah.
That's part of the training for the fellows and stuff. To do travel clinic.
All right, cool. Yeah, I'll make a note of that, then we'll reach out and try to get something like that set up. But that's something we're trying to do too, is more on-site visits. We're working on getting our website designed to have a user-friendly approach to that, and reaching out to a lot of businesses and like taking our services basically to anyone who's in need of it. So we're kind of redeveloping some of those things, expanding some more lab services. So we do have like a lot of clients coming here for like their TB blood tests, because most schools don't take the skin test anymore, or even some businesses don't. So we've seen an increase in TB blood tests. So we're like, you know what, they're coming here because we're cheapest anyways. Why not expand that service? So doing like the blood titers, like for Hep B, MMR, varicella, and things like that. So we're in the process of getting all those things updated and implemented into our standard practices. For WIC, one of the second things they're doing right now is they just now got approval this past month to start offering fresh herbs. So it's part of like the fruits and vegetables benefits they get with their WIC benefits. So now they're able to purchase that. And it's interesting, we had a client earlier today who's like really, really grateful for that, because her kids hate vegetables, but they really do love having herbs and cooking with them for their meals. So they're slowly getting some of their numbers up. A little bit increase from over last year, still not quite where they're hoping to be yet. I know they are getting pretty excited and working with health education. They're going to be providing physicals at the back to school fair here at the end of July. So they're kind of coordinating with that. And then we are working more with health education, trying to do some other offsite events, like we're doing some blood pressure screenings, education here next month, and then another one again in June.
I haven't seen any marketing. What are they doing for marketing, just to sell themselves?
So we provide some information to them. We always offer to share it out whenever we can. We do have our digital displays that we're sharing like their hours, and we've heard clients over there. I know we're getting 2 more digital displays here very soon. So hopefully I'll help continue to promote it. But I know last time, I think it was maybe 2 meetings ago, we were talking with Dr. Jamal, and they were kind of reevaluating some of like their marketing strategic planning for how to go about and get more involved in the public, try to get more word of mouth going, and trying to capture that new clientele.
I mean, we've offered whatever, so we are, like Dustin said, we are doing some things internally. We are putting up more digital signage. I think we shared what we have in the clinic. We are actually getting 2 more digital signage things, one in the main lobby and one in WIC. So we will be putting up more stuff, and we've offered to them, hey, if you have more slides or more info for Swope, we are happy to put more stuff, but we kind of need you to tell us like what you want us to put, whether it be dental stuff or whatever it is, you tell us. But if you have stuff that you want us to push out on our social media, you know, we need to vet it to make sure we're just not, I mean, we want to promote you to some extent, but in a partnership kind of way.
I don't know how much
we're making the offer, Dr. Kingsley, but they're not giving us a whole lot.
I don't know how much it costs to do like a YouTube commercial, but I can't believe it's that expensive. You're gonna hit a whole lot of people.
He knows.
I know. I've been running them for Gladstone, and I ran them for a campaign. They're very cost effective, especially when you want to geofence where the display is. You can go by county, you can go by zip code, and you can get your pricing all there. Usually need somebody who has experience with IT who's done it before, and if not, most marketing companies will afford you to pay marketing budget to put those things out for you.
So I mean, we shouldn't be doing, like, I don't want to, it sounds bad, but like the heavy lifting, they should be doing their own marketing, and we assist them in their marketing. But like I said, I don't see anything. I mean, I'm on YouTube, I walk, I don't see billboards, I don't see anything.
I mean, we have been offered.
Right.
And it's not exactly our place. So.
I totally get it. That's their business. They have to run it the way they want to run it.
But I can tell you from some of the things that we are doing for our own stuff, we have been looking at those types of formats. What's the audio stream?
Spotify.
So we have just started like this year putting out stuff on Spotify, and you can pick your target audience for, age and geofencing, like Dr. Chape was talking about, and it really does target, like, if we're trying to get people to come in and get shingles vaccines, we can say we want people that are over 50 and that live in this area. And so it's people that listen to classic rock or, in this age range or whatever. So it does work.
Yeah, that's basically my report. You won't have any questions.
So if you go further down, I just noticed that we are interacting with Kentucky. Keep going down further.
Oh, that's me.
That's you. Okay.
Yeah.
Okay. Yeah, I was like, okay, I can wait until you get to you.
Go ahead, Connor.
The only question I had for you was, the one review on SWOPE was just having more of the services offered at their central location. I didn't know what those services are that.
I think they're just a lot more in depth. Things like same they have optical there. Their dental is like more heavy. They're able to do some more
Specialty type services.
The central office is like their main one, so they have like the pharmacy, all those different things are right there. So that's like
Gotcha.
basically they went rid of us and just had it be a store.
We just had all specialties.
Yeah.
That's a big ask.
So to answer your question, you guys kind of wanted to know that I was helping other health departments with accreditation efforts.
Which I think is cool. I was just
yeah.
curious.
I'm on a national call of different health departments all over the country. I think it's like, Kentucky, Georgia, Illinois. We've cobbled this together. I can't remember who founded this group, but we resource share about accreditation efforts. And if someone's had something that's worked, we share it. And things that have been a big flop, we definitely share that. So those are the ones that specifically reached out to me recently because they're about to initially submit, and they had some last minute questions. And I put out a couple calls. Now you get to see on those emails. You see how long they are. It's fun. Yeah. Giving guidance, but to try to help other people not fall into our same pitfalls or to do better. So those are just a couple of the counties. I left a couple of them off, but I offer one-on-ones at work if you have any questions or I can help in any way to get them accredited because it's a situation.
I just like getting our name out there. You do what you got to do. I think that's awesome.
Yes, and it has. I mean, because I've done a lot of presentations and stuff that are all tracking, and they said they will jump in and help you anytime you come. So yeah, that's the standard sets that we can call them. I called someone at 3:45, 2 days before we submitted open measures, and I had 7 emails within a couple minutes. Like, people were very helpful. So on that note, this is my last board meeting. I want to go ahead and start off by saying thank you all. So you're my first elected Board of Health officials. So you guys have set a good standard. All of your comments, your questions kind of go back to the root of how is this improving the lives and health of those in Platte County? And honestly, that's great. That's what we want to get at. What? Yeah. So I do think you guys are setting that standard and always looking out. I mean, you're not paid to do this. This is servant leadership, and I really appreciate everything. So that's my spiel, and you're going to do great. I know I've thrown a lot at you very, very quickly. There's that reference guide. My phone number has not changed since 2007. You can always call me. So she's going to do fantastic. Cheyenne here, she replaced me as a health educator when I moved up to this position. She's done a tremendous job, and I know she's going to take the position even better. So I'm really excited for that. Other than that, I'll be brief. We did resubmit our reopen measures at the end of April, 2 days ahead of schedule, just because I want to wait until the last minute. But the skin of our teeth, we got there. So now we're prepping Cheyenne to take it over for the site visit. And that is the main aspect here of the World Cup committee. The two leaders, the World Cup committee, Aaron and Andrew Carpenter led a presentation to prep the staff on things we'll be looking out for when we have 650,000 more people coming. That's, what are we expecting could happen, and what do we hope doesn't happen? So they're kind of prep the staff on that. They did a great job. That's kind of it. So, Cheyenne, do you have any questions, comments, or compliments? I'm just kidding.
So when do they think about doing a site visit?
We don't know, but we can guess based off of, I've been in touch with Randolph County. They submitted a couple dates for us, and they just got contacted with their dates for site visits. There's a 2-day affair if it's your initial accreditation. So you have your virtual day. It's set for July the 6th for them. And then their in-person day, they gave them any date ranges within a week of, I think it was July 20th. So they picked the 22nd. So I assume we will find out in the next 2 or 3 weeks.
Mm-hmm.
And they actually did offer, I don't know if you remember, but Randolph County was a county that came here and visited, and we gave them a tour and we had some meetings with them. And we had a really good relationship with their administrator. And so she has offered for us to come for the site visit that they're doing.
That
So
would be
it's
very
great.
helpful.
So
Great.
probably Cheyenne and I will be going.
That would
I
be
don't know if
great.
I told Cheyenne that, maybe I did. But we might go, we're at least gonna send in on their virtual site visit, but we might go into the in-person one just to get ready for ours too.
Yeah, we will be going.
I would think so.
No, Andrew wants to go too.
Well, I don't know if I'll go, but they will be going. And I'm also not sure if we have a great relationship, because Sharon, their administrator, called me when they submitted to just make fun of me that we had not submitted, but they had. So I don't know if it's a great relationship or no.
No,
It's
she's
A little sibling rivalry kind of thing going on.
Yeah.
Nice.
I don't know.
no, it's a very fun
I'll ask her.
relationship.
What city is in Randolph County?
It's just north of Columbia. It is Moberly.
Moberly.
Moberly, okay. Says answered questions from the community about hantavirus. Are you
Several
getting a
people
lot?
called,
Okay,
and
I was just
we're
curious.
worried that it was coming to them tomorrow.
Oh,
you know?
gosh. Okay.
So, our FEs both, we got them on the phone. They answered questions beautifully and reminded people it was low risk.
Sure, the sale of rat and mice poison going through the roof.
Yeah.
Bought stock and depot.
And it's always interesting whenever we get these types of things in the press. It's a cruise ship halfway around the world and
Yes.
people are freaked out about it, yet they'll go into their basement and clean up all the mice and rat droppings and not wear any, respiratory protection. And we're like, you need to worry a lot less. And our staff is really good about explaining these things and talking to people and trying to give them resources and explain it. But it is, something that we do have to provide that education for.
And I just heard on the news today about Ebola, but it's mainly in the Congo. That'll be the next question.
Still low risk. We're already prepping like a 1-sheeter just so that
Yeah.
we're ready for that. Yeah, but we'd rather them call us
Yes.
than go to Facebook, right? So we're happy to answer those questions, and they do a great job.
I did my fellowship at the University of Nebraska Med Center,
Um,
so I got to see
Oh,
that
you got to
facility.
see that.
So they did actually have an Ebola patient there. It was
Yeah.
I believe it was a
Oh, they
nurse.
did?
They shipped a long time ago.
Okay.
Yeah,
Yeah, I
and then they have
remember
a
that, too.
hantavirus there too.
Yeah.
And I'm sure that Ebola virus, I think it's a doctor or something got
Yeah.
exposed. He'd
Mhm.
probably be coming there as well. Yeah, and then my daughter graduated last weekend in Omaha, so I was exposed to hantavirus. So I was in Omaha.
Oh,
When we had the Ebola scare, probably 13 or 14 years ago at this point.
Yeah.
I was working at the City of Independence and I got a call probably 1 o'clock in the morning. And it was from the jail because one of the people they'd arrested had been exposed to Ebola. Well, he didn't want to get arrested.
Sure.
I've been exposed to Ebola.
I was actually supposed to go to West Africa right before Ebola hit, and I was supposed to go to Guinea for Peace Corps, and then it was like a couple weeks before Ebola hit, and then they decided
Oh.
we're gonna close our programs there.
I'm glad that's your story and it wasn't you that's getting arrested.
Like Cindy, you missed out on the background check.
It's a nice facility. It's pretty cool.
So this month we did not meet, the finance committee did not meet, so Susan doesn't have anything to report. I'm sorry. Sorry, Zach, we pumped you all up to come meet and you didn't get to.
It's all right. I was like, man, this joke's
We cancel all the time.
But we do need to review and approve the bills.
Oh, yeah. Anybody? Got a chance to look? If you need more time, I can.
I move that we approve bills.
Okay, do we have a second?
I'll second that.
Okay, further discussion? Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
It's a done deal. Do we have checks to sign or do you guys do that?
We did.
You guys
We
are
already
way
did.
efficient.
This is all the, this is it.
Wow,
We
okay.
do.
Have to see, in anticipation of the Japanese encephalitis, we've added that, and that will be, once it's available, be going for $403 a dose. And then we had a modification to Penticell. It actually decreased, so it went from 111 and it's going to go down to 73.
That's pretty cool. So do we have to approve?
Yeah.
Yeah, okay. We have a motion to approve the changes? Anyone?
I move we approve the vaccine changes.
Okay, do a second.
A second.
Any further discussion? Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
It's done deal.
Okay, back to Taylor.
All right, so Andrew started to mention this, but part of the core funding from the state, the last 2 years, we've been getting incentive funding. So this year, it's kind of small to see on here, but there were several factors that you had to attend or do to get incentive funding. We reached all of them except for the one of actually being accredited, which hopefully next year, if they decide to do that one again, we're gonna look at that. But Andrew and I attended both the administrator regional meetings in the fall and the spring, as well as a 2-day grant management session that was put on by the Missouri Public Health Institute. And then I completed the mental health first aid completion. I don't know if you did.
I'll let Taylor
But I did that, yeah.
take one for the team.
So we got close to $26,000 for those things from the state. I don't think there's really any board action with that.
No, we just wanted to let you
To
know
let you know,
that
we got
we
some
are,
money.
So it offsets a little bit of the cost.
Sure.
and I guess that was one of the things Dr. Kingsley and I had talked about. He had asked me, like, so does this pay for accreditation? And I said, well, no, because one of the large costs, at least how we're doing it, is Rebecca's current position is an investment. But really, it's supervising some positions. So the position is not just doing accreditation, but the other part of that position, when we're not doing accreditation, is continuous quality improvement. So when we're not doing accreditation, that job is focused on looking at things throughout the department and systems and processes and always continuously improving. It is a true management position dedicated to improving processes. So it's not just about accreditation, it's about improving everything throughout the department. So it is more than just that, but this does help offset our $8,000 that we have to pay for accreditation related expenses, and then part of that salary too.
Now, remind me, is this just a one-time deal or do we have to reapply for this next year?
So this is one time, and I think this upcoming year, it'll be more geared towards the resource sharing. So I don't think it'll be these same things, but I don't know yet because they haven't told us for sure yet.
It hasn't been a one-time deal. It's at least been the last 3 years, but they do different things each time.
Different hoops we have to jump through.
Yeah.
This year, I think it'll be resource sharing.
Hopefully it's also accreditation too. We'll finally be accredited, so hopefully we get that part.
I don't think it's going to be though.
Andrew ruined it for us.
Oh yeah, we talked about this too, yes.
Do you want to talk about this or?
Whatever you want.
So when we moved into this building,
Yep. Yeah.
we had some areas of the building that we didn't touch where there was zero remodeling done. And one of the areas, and I think everyone knows this, was originally this building was the childcare for the old City Core World Headquarters. One of the areas that didn't get touched was the old commercial kitchen that was the commercial kitchen for the childcare. And Cindy, you may have to help me because I think, well, Dustin too, you guys were here when they talked about this, and maybe you, Dr.
I was at the
Kingsley.
tail end of the discussion.
But they weren't going to do any remodeling to the original commercial kitchen with the kind of idea that maybe they could do some food handler classes in there so they could teach people good food handling practices, or maybe do some for health education, do some healthy recipes and teach people how to cook healthy recipes and do some stuff. And just over the 3 years that we've been here, we have, and I'm not sure why, but before I got here, they got rid of all the commercial refrigeration. So we didn't have any commercial refrigeration. The commercial dishwasher that was in there wasn't working, and I guess they got rid of it. And so we don't have a lot of the things you would need. Also, when you are trying to teach food handlers good food safety, you actually need food, and you need to be prepping food, and you need to be taking temperatures, and you need soil ware washing. I mean, you need dirty dishes so you can do good ware washing and different things. So some of that is just kind of hard to do. And the number of people coming in for in-person classes has steadily dropped. Most of the people are coming in. So we're just not seeing a lot of need. And for cooking classes and stuff, it's a commercial kitchen. So doing the stuff in a commercial kitchen to try to teach people how to do the stuff at home, not really a great environment. And one of the things about this kitchen is because it's a commercial kitchen, we have a commercial hood system and a commercial fire suppression system, or ANSEL system, that we have to pay about $1,500 a year to get inspected and to maintain. It's a lot of money.
When you're not using it.
And we're not really using it. We have a little emergency food pantry, and we have a little bit of other food storage for like the employee canteen, that we are currently storing all that food in like closet space and other storage space. That my preference is to decommission the hood, get rid of the equipment, because we can't have that commercial equipment there. But basically decommission that kitchen. You can do it permanently or quasi-permanently. And just use that space as food storage. Keep the 3-top sink and not have to pay $1,500. But because this is kind of a policy decision about how to use the space in the building, I wanted to bring it to the board just to make sure you all were on the same page with us.
I strongly support what you're doing. Utilize the space you have, minimizing the ongoing recurring costs when there's not a big need. Are there options for people who need, we will be able to provide some sort of training, or is that training going away for a while?
We do it online.
Okay. All right, so this was an extra perk. So if we don't have this, there isn't gonna be a need in the community for this.
My daughter just did their food handling thing, and it was
Just making
all
sure.
online.
I'm saying this to keep it straight in my
Yeah,
head.
it was all online.
Since
We just
COVID,
watched
we've
it.
offered it online, and it seems like there's been an increase in people who want to take it online.
Correct.
And so people don't want to come in and sit for several hours in person. They'd rather just do it quickly online and run through it.
And we've never had an option to do it in a kitchen. And, you know, I have done in my previous jobs food inspections, and really being there in the kitchen with somebody, that's where I take the test strips and show you how to read the test strips for bleach concentration and, you know, take temperatures and stuff. There's no food there. There's nothing to take a temperature.
Right.
I can't show you how to.
I would move to authorize the director to evaluate the decommissioning of the commercial kitchen and repurpose the space for food pantry, food storage use as appropriate.
I'll second that.
Any further discussion?
I just have a question. When you say food storage, what are you saying? Like, what are you?
So, like,
Okay.
WIC has an emergency food pantry, so they have like food storage. So we would clean all this up, put some shelving. We already actually have the shelving, and use that space to keep the stuff in there. The employee canteen that is run by the social committee, that food is like right now, like on the floor in one of the closets. It really needs to be off the floor and in shelving in a little corner. You can't really see it, but there's a cubby hole that would be around the corner from the food pantry. It's where that metal table is in the lower left.
Okay. I mean, the only reason I asked is I just wouldn't want us to become, I get what you're saying now. I was thinking we were becoming a food pantry kind of, that's not what we're interested in.
Yeah.
Okay.
I know what you were thinking.
Yeah. Okay.
Using that space for harvesters or something.
Yeah,
Like
that's.
So, and if you ask any of my team, I'm very anti becoming known as the food pantry people.
Me too.
We do the harvesters because it is a good exercise every month, but we are not about becoming a food pantry. We do the emergency food pantry because we do end up having people in here that truly do not have anything to eat tonight. And we have some community people that have provided food, and we put.
You can call on them to assist.
They have donated to us, and we're able to provide that emergency service, but it is not like we're not listed on anyone's resource list.
Okay.
It is basically so instead of all the employees pitching in $30 on random Tuesday nights.
Yeah, gotcha.
We can go back and give those people something to eat. But
well,
this is the most advertising we have done.
Okay. Very
so you and I talked. So basically, what you're going to do is all the appliances you're going to put on whatever GovX or whatever Gov deals. Yeah. So that'll be cleaned out. But you wanted to keep the sinks, is what you were saying, and then the rest of the space we'll decide what to do with it in the future.
Well, it'll be just shelving and food storage.
Until you have a better purpose.
that where that's being stored now for WIC, that would give them more office space? Is that what?
It's storage, like
Is
it's
it just
that
a closet?
right
Okay.
there.
Okay.
So it'll actually be for like the tables and chairs and stuff, but
Okay.
it'll be better for
Yes.
like the stuff, some of the stuff that we should be storing in there.
Okay, so we have a motion and we already seconded it. We already have our discussion. Anything else before we vote? Okay, Susan,
Yes.
Kim,
Yes.
me, yes, Mike,
Yes.
Seth.
Yes.
All right, the next thing is the question for city to refer, the QPR agreement. So Mark, the Mid-America Regional Council is offering free training for the QPR program through the QPR Institute. And they are offering basically free training. It's similar to mental health first aid training. It helps recognize signs of suicide. It helps with supportive conversation in order to prevent suicide and mental health issues. They are going to be offering the training for free, and then they'll reimburse up to $1,500 to do up to 5 trainings between now and the end of September. Any questions about that? So I attached the MARC agreement. We also found out there's another agreement through the QPR Institute that we also need to sign. So I added that.
So explain kind of what the whole point of question, persuade, and refer is.
So it's kind of similar to like mental health first aid. It's essentially being able to recognize signs of suicide or mental health issues, anxiety, distress, and kind of prevent suicide. It would largely be for us to do for, maybe teachers or community members, librarians, different people throughout the community to train them up on that.
So we are required to do 5 teaching classes or whatever, but we probably do more than 5. Is that kind of the plan?
Yeah, it's just 5 between now and September.
That we have to have done, but
Yeah,
can we
And we
do
would probably just
do the 5? Okay.
and it can be virtual as well.
But then
Right.
we would have had the training and we would have the materials so we could do more in the future. And we have had requests from different places who wanted this training before, so it would be nice just to be able to offer it.
Yeah.
Do we already have people that want to do they want us to go there already? Is this all lined up already, or?
There's a few people who are interested. I don't know if we'd probably either offer it here or we also have the option to do like a virtual course.
Right.
It's just like a 1 hour online, or it can be online or in person, but just a 1 or 2 hour course or training.
I'm curious, I'm very much in support of this and we'll jump on it to move on to the next agenda item, but it's more of an academic question. Who funds Mid-America Regional Council? Where are these funds coming from? And what are they trying to achieve by putting something like this out? I'm looking at the bigger picture. If it's one-time training for people to be able to manage critical situations, but why just do it once if there's an ongoing demand? I'm trying to think outside the box here. So what is it they're trying to achieve with this grant? If anybody knows.
If I may?
Sure.
So in my current role as a health educator, I'm part of the 988 Local Crisis Advisory Council Board. And they have extra grant money that needs to be spent before September. And during one of these board meetings, we were talking about ways that we could do it, and that's how it came up.
Thank you.
Thanks, Diane.
Sorry.
Not
Not that I expected an answer. I was explaining my question is, I don't think anyone, I have a weird perspective on things and I look to what's the purpose also? And what is that a need that we don't have? And as a trustee, I think I'm trying to drill down. Thank you for that. I figured something as much. Just trying to identify an unmet need in our county.
So instead we're funding the money, they have to spend it.
Yes, we do have to spend.
Wonderful. That's
So we're gonna get some extra training in our county. I think we should take advantage to get as many people trained as we can.
But Mid-America Regional Council, they serve like 9 counties and 119 cities in the Kansas City area, both Kansas and Missouri, and they cover a wide gamut. So they do public safety, they do a ton of like highway stuff. So like when it is like Kansas and Missouri, so when there's federal grants that like for the interstate system that covers both Kansas and Missouri or goes through multiple jurisdictions, the radio system when it first came in through the early 2000s, that interoperable 700 megahertz radio system, that was a huge mark project to get everyone together and on board. So, because it used to be like Independence radios didn't talk to Kansas City radios, and now all those radios are compatible.
So there's a niche.
Mark does a lot of like stuff, coordination between all the different municipalities and counties.
I was just curious where they get their funding. It sounds like they're
It's all
good
grants.
federal funding and federal grants.
Yeah, it's all
that
grants.
they help coordinate the applications
Right.
to meet the needs of what's going on. So thank you. That helps. I was just, sorry.
And it's actually,
We weren't behind and I had a curious question.
Do we have a motion?
I move to authorize the director to sign the question persuade refer professional service agreement with Mid-America Regional Council.
And the QPRs.
and
The QPR.
the QPR Institute.
Sorry, I added that in.
Okay, and the QCR Institute.
Do we have a second?
A second.
Any further discussion? Susan?
Yes.
Kim?
Yeah.
Me? Yes.
Michael, yes.
Yes.
Okay.
So I looked them up. Trustees.
And then the last thing is a personnel action. And I'd encourage the board not to let Rebecca
I
resign.
was gonna say, we could just deny it, right?
They don't allow you, you can't go.
Call the sheriff.
Shall we?
All right, well, somebody has to make a motion.
I move that we accept Rebecca Richardson's resignation for position of full-time accreditation and QI manager effective June 12th, 2026.
And do it to the Cheyenne at the same time?
Yeah.
You have to do Cheyenne as well.
All right, and I move that we hire Cheyenne Brunco as the full-time accreditation and QI manager effective May 25th, 2026. And her scale step will be at 17M 4D, starting salary at 38.60 cents an hour.
Do we have a second?
A second.
Any further discussion? Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
All right, Pat. You choked on it there.
Last meeting, I choked because
Yeah, I was gonna vote no, but I can't say no to Cheyenne.
Hey, she answered a question for me, so we'll take her.
Yes.
Resigned a lot. I've never had someone have to vote on it, so that was.
Kind of strange, isn't it?
Especially when you're here.
They gotta hold you back for
Very
you'd be somebody I would want on my team, whatever the goal we were working on. So just,
So this is the new updated public comments or something, or what's this?
No, we
Just,
don't
if we
have-
had public comments or something.
Does this need to be signed?
yes.
You can scroll through this, or Dr. Kingsley's gonna wanna go into executive.
Oh, we have an executive session,
No,
okay.
No, we don't.
You get me all excited for nothing.
Otherwise you'll read it.
I don't- Nobody told me there was gonna be, I was like, okay, we're busy.
Yeah, there's
Yes.
resignation.
Getting us all excited for nothing.
Does anyone want a motion to?
Oh, yeah, is there a motion to adjourn the meeting?
I move that we adjourn the meeting.
Well, the next meeting,
When is the next meeting? Can you have that popped up?
go to the beginning.
Looks like
See,
June
next meeting,
18th.
June 18th,
June 18th, okay.
6 PM, at Platte County Health Department.
All right, so this ends this meeting, after we have to vote on it, but basically, and then we have the next meeting on June 18th, 2026, 6 PM at the Platte County Health Department. All right?
Yep.
Is there any other discussion on that? Do we have to second it, or what do you want? You want to second it? We already did that, right? We went to vote? Okay, this is vote,
You don't
okay.
have to vote.
You don't have to? We just ended.
Well, you need to vote to.
I know, so I said, you said no. Okay, Susan.
Yes.
Kim.
Yes.
Me, yes.
Michael, yes.
Oh my goodness.
Okay. That was
We
easy.
did really good today.
And then we
Till the end.
choked.